Demonized and suppressed by the war on drugs, psychedelic medicines are making their return, and we're here to bring you the latest in scientific research and therapeutic practices involving psychedelic medicines from psilocybin to ayahuasca to DMT and beyond. This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we are talking psychedelics and improving health habits with Dr. Pedro Teixeira. Pedro Teixeira is a professor of physical activity and health at the University of Lisbon and is the current director of research for the Synthesis Institute in the Netherlands. He holds bachelor's and master's degrees in exercise science and a PhD in nutritional sciences. His main research interest is health behavior change. Now, this episode is for everybody out there who says, I'm really glad psychedelics are helping with these, mental and physical health conditions you keep talking about, but what about me? I just want to improve my day-to-day life. I'd like to exercise more or stress a little less or maybe quit smoking or work on decreasing tobacco or improving my sleep, things like that, just health behaviors that you may want to be changing. And that's exactly what we're talking with Dr. Teixeira about today. So I hope you enjoy this episode. Now, before we get started, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And a reminder, as always, if you are a medical professional, a clinician, an acupuncturist, somebody who sees patients, a therapist, anybody on that front, and you'd like to learn more about psychedelics, please join us at the Psychedelic Medicine Association, where it is our mission to educate you more on these therapies. You can find us at psychedelicmedicineassociation.org. And also, I'm going to say this because I never say this, but somehow you all seem to be finding us on Instagram. So we are also at Psychedelic Medicine Association on Instagram, and we are also on Twitter at psychedelic_med is where to find us. We're also, if you're extra super nerdy like me, we're on LinkedIn. But find us in all the places. All right, now without further ado, thank you so much for joining us today, Pedro.
Thanks, Lynn Marie. It's a pleasure to be here. I've been listening to your show for a while. I've learned a lot with your show, so it's really nice of you to have me here.
Well, I think perhaps that's how we first got connected. And then I had the great fortune of spending lots of time with Pedro when I went to Portugal last year and got to be even more familiar with his work. And I'm excited that we finally get to bring that work to the listeners, Pedro. So thank you so much for coming on today. And let's get into how psychedelics can, I called it in the episode, improving health habits, but the field of research is technically called health behavior change. Can you talk a little bit about what we mean by health behavior change and what that covers?
Sure. So it's kind of a new scientific field or scientific sub area, if you'd like. It comes from the convergence of different areas of knowledge. Perhaps the most closely related would be health psychology that people can relate to. So it's basically around understanding what, the behaviors that are most impactful on our health, on our mental and physical health, and understanding how they change, what determines them, how healthcare providers, for instance, but the public in general can be more effective in helping other people change or creating the best conditions for change. It can go really from thinking of individual health, from a primary care physician, for instance, looking to improve, the diet of their patient. But you can also think of it in population health, in public health terms of population health. And I think we don't need to go any further than thinking of COVID to see how, our health was really dependent on behavior. And understanding how people would be reacting to messages about masks or messages about the social distancing or being confined, and how, in this case, governments could facilitate those changes, could create the best interventions, if you can put it that way, that would be more effective and more well received and better at lasting behavior change, which is really the key issue here, because health, or the concerns around health, have changed from, well, if we take COVID aside for a second, have really changed from transmissible diseases to chronic diseases, to diseases that may last a lifetime. So what we're really after in health behavior change are promoting in our clients, in our patients, sometimes in our families as well, but also at a population level, lasting behavior changes, because those are the ones that will be most impactful in the things that most affect health these days, which are chronic diseases like diabetes, obesity, heart disease, cancer, and so forth.
And so some of those behaviors that we're looking at that impact a person's potential to develop those chronic diseases are things like diet, exercise, sleep patterns, stress, things that might add to or decrease from stress. Those are some of the behaviors that we're looking at, correct?
Indeed, indeed. And we often think of the big four of diet, exercise, alcohol, and tobacco as really they really account for an overwhelming majority of health related problems in society, whether it's healthcare costs or personal suffering, or other things that just the diseases that most cause suffering and premature mortality are basically caused to a large extent by these behaviors and the ones you mentioned as well. Of course, the way with the way we sleep, the way we manage our stress, also things around substance use disorders are also impactful on our health, and they are related to behavior. And this is actually a nice link to psychedelics, because it's the closest we've had in psychedelics to health behavior change is really the work on substance use and tobacco and alcohol that comes from we'll get there later, I'm sure. So yeah, you're right. It's come to be a specific field of study. We now have international societies totally devoted to studying health behaviors and how they change, and what are the theories that are most important, what are the best interventions, how practitioners can be most effective in their techniques to helping clients change behavior. That's an area that I've worked a bit as well. So you have, for instance, Society of Behavioral Medicine in the US. It's a huge society. You have the International Society of Behavioral Nutrition and Physical Activity. It actually has a meeting coming up in Phoenix not too long from now. I've been involved in that society in the past. So there's an entire field of knowledge, and also and also practical applications for healthcare providers and for other people in the field to help to understand better how people change, and then be more successful in something that is very hard to do, which is helping others change behavior or ourselves change behavior. We know how hard that can be. So we're far from getting from having all the answers, but it's an ongoing scientific work that I've been involved in for now close to 2 decades.
Well, before we get to the details of how, because, we've got listeners here, they may be thinking, how can psychedelics help me personally change my health habits and my health behaviors? But before we get into those details, usually a lot of the focus that we've discussed here about efficacies for psychedelics has focused on mental health versus like physical health, preventative or behavioral health. Is this changing, and why do you think so, if that is the case?
Yes, I mean, I think we're all familiar with the groundbreaking sort of progress that has happened recently in psychedelic science, mostly around mental health issues, depression, anxiety, PTSD, and so forth. Those are the ones where we have, at least from the most recent bout of research in this century, that's where we know the most in terms of the promises of psychedelics. But I think it is changing. I think there's now new studies, new inquiries, new questions that are being asked and answered around also physical health, and that includes the things like I was talking about before. So there's now a renewed attention or curiosity about for instance, how would psychedelics impact one's diet, and if that's the case, because diet is such a lifestyle factor, such a predictor of health in the long run of one's health, we would be talking then about outcomes around physical health as well, diabetes, heart disease, things like that. And I think there's other examples as well of people looking for answers to pain, for instance, is another example of physical health. And this could be chronic pain, but it could be migraine headaches or cluster headaches or other types of physical pain. I think you're familiar with the work on traumatic head injuries. It's another example of just physical health outcomes where psychedelics may also play a role. So I think we are making that shift, or at least being a bit more encompassing in our scope, which makes sense because physical health and mental health are closely connected. Of course, it's very much the case where someone is suffering from a mental health condition or dysfunction, and it reflects on your physical health because you're not eating so well, or you're not exercising anymore, you're not socializing so well, and so all of a sudden, it's a cluster of conditions or of dysfunctions of one's health. There's also a scientific view on it because behaviors are a bit more, in some cases, are a bit more objective and a bit more easier to measure. And you want to make sure that whatever changes people are going through, they're having, they ultimately reflect on some kind of behavior change, whether it's, around your own health, but it could also be around social health. It could also be around the way you interact with your environment, or the way you connect to nature, and the way you protect your environment. So there's also this desire, I think, to move from sort of changes in internal states to changes in things that society can watch and observe and more easily discuss, perhaps, whether the behavior is good or bad for society. Whereas internal state could be, it could be a bit more debatable. So there's several reasons, and I'm just highlighting a few points where, for the reasons I think things are shifting a bit, and the scope is opening from just mental health to broader health.
Yeah. Well, regardless of the reasons, I'm glad to see that it's happening. Has there been any previous research done regarding health behavior change or changes in these lifestyle or health habits?
Right. So strictly defined, the way I defined it before, I think you usually look at diet and physical activity as the key behaviors to change when you're talking about behavior change from a lifetime perspective. And the answer is no. There hasn't been any specific sort of trial or intervention that has looked at directly as to answer the question: do psychedelics make any difference in the way people eat or the way they move? So in that case, there isn't, but there are sort of indirect lines of evidence, let's say. Of course, we do have evidence for alcohol and for tobacco, and also for other substances, for opioid addiction as well. So there are indirect evidence that behaviors can change, but we are strictly focusing there on mental health and addiction. And the two usually go together. So if you think of mental health and addiction, yes, in the addiction field, there are already some evidence that those behaviors can change. If we are thinking about diet and physical activity, about stress management, although there is some evidence for anxiety, we really don't have anything specifically thought out for that purpose. But we do have observational data. So what's happening now are very interesting studies where we look at large samples in the population, American samples, UK samples. There's also some more specific samples that have used psychedelics. So the question for these new studies that are very recent, actually they weren't included, most of them, in the publication we might discuss later. But what they're showing, they're comparing lifetime users of psychedelics, of people that have used psychedelics at least once in their lifetime, with people that have never used psychedelics. And then they are comparing their health on the one hand, but in some cases they're also comparing the behaviors that they engage in. And those seem to show that for some reason, psychedelic users are not only healthier from a physical health perspective, but there's also some indications that is caused by some of their behaviors. There's a very recent study by Charles Raisin and colleagues, and they've looked retrospectively as a large sample of group of psychedelic users, and they asked them retrospectively about changes in their mental health, but also changes in some of their behaviors. And I think around half of them reported that after they've started using psychedelics, they have changed their diet. And we presume for the better. We're not sure yet. We presume that for the better. So those are some of the evidence that we have. There's also some secondary analysis from, for instance, the depression studies or the tobacco cessation studies, where they've looked at other changes that were happening that were concurrent to the mental health or the tobacco, in this case, tobacco cessation. And in those cases, people are also in surprisingly high amounts or large numbers, spontaneously reporting that their diet has changed, or they became more physically active, or all of a sudden they're socializing more, or they're more willing to be in nature and having nature-related behaviors. So we have a lot of indirect evidence, some qualitative data as well. And there's at least one microdosing study that I know of that also reported some positive behavior changes upon using psychedelics. But it's all indirect evidence. We really don't have any trials that have looked at this question specifically.
Gotcha. Now, before we get to your paper, I think you were just referencing the PAUSE study, right? With Charles
Yes,
Raison and
indeed.
the Janes.
Indeed.
Okay.
Indeed.
We will link that in the show notes. There was another paper that came out recently that proposed the concept of behavioral psychedelics. I realize you're not one of the authors on this, but if you could tell us a little bit about what behavioral psychedelics means and what how it may relate to one's desire to use psychedelics for improving these health behaviors.
Yeah. Yeah, it was very, very surprising in a way, positively surprising editorial of sense. It was a commentary paper, a short paper that really, for the first time, used that term, which is interesting because it's looking at psychedelics definitely from a behavioral lens. That's really what they are suggesting we do more. They have a definition for behavioral psychedelics, which is something around the study of psychedelics to foster intentional changes in habits and behaviors to improve health and resilience. I'm seeing the definition here, so it's very interesting. They're including this intentional change in habits and behaviors, and I think that's the critical issue because we are seeing a lot of spontaneous changes that are people are not intended to they were not thinking of changing their diet or being or smoking less, and all of a sudden they are smoking less. In this case, I think is looking at it from a more proactive, in a more premeditated way, and I think what they're proposing is that we start including conversation around behavior change in a more proactive way within the context of psychedelic experiences and psychedelic therapies, so that practitioners are a bit more prepared and willing and knowledgeable also about behavior change in a way that they are introducing this discussion into the conversation. If for no other reason, I think people should expect some. I mean, it's common that these changes happen. So it's kind of I think common sense that we talk about them. This could change. There are changes that can occur in your lifetime habits, and we can be more prepared for that. So that's, I think, one of their points is setting a container in psychedelic experiences that is more favorable to health behavior change. We know that that psychedelics are a bit unspecific sometimes in their change, so they're very sensitive to how you set the experience. So if there's a bit of preparation around, how might my diet change? How am I physically active, and would I like to change that? How am I managing my weight, for instance, which is related to exercise and diet to a large extent? Can that be part of the conversation? I think that's one of the things that they're suggesting. And the other one is that we actually include more behavioral measures in research. So if we are studying mental health, we can also include in our measurement batteries something around monitoring behaviors before and after to see what's changing and perhaps studying best why that changes. And that's one of the things I'm interested in, and we might touch upon that later.
Yeah, I think that's a really good point because we so often focus on is the outcome my depression is better, but not necessarily the other things that tend to come along with. And it's a chicken and egg situation, right? Like if your depression gets better, do you also start moving more, or is your depression better because you're moving more? It's hard to say, but in the end of the day, most of these psychedelic studies are showing improvements in the symptomology of these conditions. But like you said, there's a lot of behaviors that kind of go, hand in hand with these conditions. So I really like that idea of not only setting, okay, so often we go into it, I'm going to set the intention of, I'd like to be less anxious, or I'd like to be, find more joy in my life. But we don't specifically say, I like to find more joy by spending more time in nature or increasing activity or meeting with people more. And I like that it actually gives you something more tangible to kind of, I don't want to say focus for or aim for, because we don't like to set hardcore expectations going into a journey, but I think at least, like you said, it puts things into the mind that may not have been so tangible before.
Yeah, and exactly, and I think it also fits well with this idea that we already have, and we will progressively have more and more sort of healthy people undergoing psychedelic experiences, meaning at least not diagnosed with a condition or not within the context of a specific research study or clinical treatment. So if we have people that are already sort of free from disease, what are they there for? They're there to feel better, and a lot of that is through healthier behaviors or behaviors that are more consistent perhaps with their values or with their long-term goals. So basically, I think we are already seeing these things, and if one is familiar with what's going on today in some places in the underground, some in other countries or in other places in the overground, we know that many people are seeking psychedelic experiences to have sort of fuller lives, to have richer lives. And I think that also encompasses, to a large extent, being freer from some limitations around your body image or around. I mean, I can speak about myself as just a simple example. I grew up largely unconnected from nature. And being more connected to nature is one of the side effects that I gained from some psychedelic experience some time ago, and I wasn't seeking for it, but it really enriched my life. So what if I was seeking it, and what if there was an intervention, planned around nature connectedness? What if in the future we could have, a therapeutic program or a community program where people would be undergoing these experiences in the container, in the context of a nature relatedness sort of program? Just to give an example, I could give an example of a weight loss or a weight management or a weight control or preventive weight control program. I've worked in weight loss trials for many years in the beginning of my career. Those are group settings, and people are undergoing changes in their diet and physical activity, and all of a sudden many other things are changing in their lives. So I think in the future we might be moving in that direction also with psychedelic assisted interventions, let's say.
Yeah, I think that's great. I love that you brought up the nature relatedness as an example. By the way, if you all want to hear more and you missed it, we had Dr. Sam Gandy on talking about his study with psychedelics and nature connectedness and nature relatedness a few months ago. So check that out. But I think when we have Oregon coming up, where an entire state is going to have this model where people can access psilocybin, I think it's going to be a great, statewide study to see how does the health of the people in the state who go to these centers improve, because you don't have to go, like you said, with a DSM diagnosis of anything. You can just go because you want to, they call it a medical model, or they had been calling it, but I think they were trying to get away from that because they don't want you to have a medical condition. You're just going there to improve your well-being, which is part of your medical health. It's, I guess they had to call it something, right? But I think it'll be so interesting to see how the health of the people who avail themselves of that psilocybin therapy improves in the behaviors that you were just discussing.
Yes, by all means, and what better way to convince future politicians or policymakers than to show that people are actually improving the quality of their lives and their health habits and saving healthcare costs, and eating more sustainable diets, perhaps. Um, if indeed the studies in Oregon and in future in other places are showing that there is a preventive aspect, there is a sort of a lifestyle enhancement aspect to these experiences. This actually reminds me of a study. One of the first studies that called my attention to these possibilities is a very interesting study done by colleagues at ICEERS in Catalonia, and they compared the health and the well-being, including physical health measures of BMI and some physical activity, diet, and I think there was a couple of other measures, also subjective well-being. Compared ayahuasca users, I think more than 300 ayahuasca users, with a general population in Spain. This is a study that we're actually trying to replicate here in Portugal, and that has been replicated in the Netherlands as well. It's just about to get published. And what they saw was that this group in the population, this group of ayahuasca users, were actually healthier than the Spanish general population. They had a lower BMI, so they have less obesity, they had better eating habits, they were more physically active, they smoked less. And so, this is sort of a new perspective on psychedelics, that they could have this preventive role, if, of course, used in the best of conditions, and if populations learn how to use them well. Of course, there's a lot of ifs. There's a lot of work to be done in public literacy, and in many other areas, as you know. But I can foresee a future where we can also look at psychedelic experiences from this perspective of improving health and well-being and quality of life, and not just the reduction of disease.
Yeah, absolutely. And that leads us into your paper, Psychedelics and Health Behavior Change, that came out last year. Can you talk about a little bit about some of the ideas you introduced in that article?
Sure. Yes. So this is an area where I've been working, for a while now, since I had my PhD in the year 2000, a long time ago. I've been working in understanding how people change, and weight loss interventions, physical activity interventions. So this was the area that I was interested in for a long time. And once I became familiar with psychedelic science, and what psychedelics were really, which were I'm a Polonized. I was Polonized by Michael Pollan, if you don't mind the word. So I was new to psychedelics before Michael Pollan. I didn't know that. Didn't know anything about it. But once I did, I started paying more attention to psychedelic science. and at some point I realized that there might be a link here between what change in psychedelics might induce and health behavior changes that I've been studying. So the goal there was to, well, we were trying to reach health behavior change researchers and tell them about psychedelics and psychedelic science, and simultaneously I was trying to reach psychedelic scientists and tell them, look, there's another area here that we might explore collectively, which is health behavior change. So it's a bit of a hybrid paper. And so we start with an introduction around psychedelics and the mechanisms behind psychedelics, from a general perspective, and why they might change behavior. And then we review the evidence, the indirect evidence that I've covered before, all that we could grab that could be of an indication that psychedelics could be positive for health behavior change. So we review that evidence. And then in some of the mechanisms, when we discuss mechanisms, we also introduce a couple of new concepts, perhaps to the psychedelic field, not to psychology by any means, but that come from the area that I've worked a lot in the past 15 years, which is around it's sort of the use of motivational science to help people change behavior from a specific perspective, which focuses on self-determination and to the degree to which people feel autonomous in their choices in life, feel self-directed, and really sort of self-endorse their actions at the highest level of reflection. So it's basically stating that when you behave from a self-determined perspective, or when you're motivated more internally as opposed to being more externally motivated, your outcomes will be better, your behavioral outcomes, but also your health outcomes. And there's lots of evidence around that. And I've worked to sort of confirmed some of these assumptions in behaviors like physical activity and obesity, and it seems to work well. So we introduced that concept as well, and the question is, might psychedelic experiences also help us feel more self-determined, feel more autonomous about our choices, feel more internally motivated, to the extent that we are not so concerned about social pressures or pressures from the outside, but we are more focused on what's really important for us. And moreover, we feel more efficacious. We feel more competent and more ready to make those changes. And I think many people have reported feeling that way. So when they go through a successful psychedelic experience, they feel like they can finally make the changes that they've been thinking about. They're finally possible. They seem easier. They seem more at reach, if you'd like. And so we also have some qualitative evidence, some interview studies, very interesting interview studies from the tobacco cessation studies and from the depression studies and from alcohol cessation studies, where they've interviewed participants. The most famous study is a study by Rosalind Watts on the depression trial. And if you read the participants' accounts, you can see some of these messages coming through, that I felt more self-determined, that I felt more self-efficacious. I could finally make those changes. And I also felt more connected. I also felt more competent. And those are the premises of self-determination or self-determined motivation. And so we are making those links in the paper as well, and hoping that others might also pick it up, and we can study that more specifically. And that's one of the things we are hoping to do in the near future, is seeing, are these mechanisms really changing? The underlying psychological mechanisms of self-determination, are they changing through psychedelic experiences? So we're foreseeing future interventions where we might use some of these techniques that we know to increase self-determination. Perhaps in the future they might be used also in psychedelic assisted interventions, to make it brief.
To make it free. Well, to dive just into one section of that, like you said, you covered some of the evidence from tobacco and alcohol trials and all that. Can you talk about just a little bit about what evidence you pointed out that suggests there may be a link to be explored between psychedelics and these behavior changes in the area of diet, activity, and obesity?
Yes. So all indirect evidence, as I said, I think the most so the most interesting ones are perhaps where you see that when people are undergoing the tobacco cessation trials or depression trials, they're also reporting changes in say physical activity or diet. And those are sometimes very high numbers. You have numbers like 50, 60, 70% of people are saying that they've had major changes in other areas of their life that weren't covered by the intervention. And so I think that's one of the more interesting lines of evidence or indirect evidence that we have. And we are now looking at some of these population databases, And we also, one of the authors that have published on this topic the most is Otto Simonsen, a Swedish researcher who has published 3 papers in the last year showing that psychedelics user had better or lower heart disease, or lower rates of diabetes, or lower rates of obesity, or lower rates of hypertension throughout their lives. And so we are working with him now because there's some data that have also looked at diets. So we're interested to seeing if indeed these changes, these positive results, or these positive outcomes that you see in physical health might be related or are also observable when you look at the behaviors directly. We're also in touch with Charles Rayson and the team of authors from the PAUSE study, because they have very interesting data from this retrospective trial of psychedelic users, and they've also asked about diet. And I've reached out to him. I knew him before, and they were very positive about doing some subsequent analysis on their paper, looking at who are these people that are changing their diets, what other characteristics do they have, and how might that relate to the psychedelic experience. And they also have data from other behaviors as well that we're exploring. So we're trying to get closer and closer to sort of the best indirect evidence or the best observational evidence. And I think the future will be, so I guess another line of pursuit that we might look at are studies that go into psychedelic retreats, and where we know that people are undergoing psychedelic experiences, and we might study whether their behaviors are changing. So that hasn't been done as well. So that's another line of evidence that we might pursue within the context of the ceremony study from Imperial, with whom we have a collaborative work going. And we're adding measures to their battery of questionnaires. There's wonderful papers that have published. The most recent, perhaps the one on communitas and the feeling of connectedness that arise after psychedelic experiences. So by adding extra measures of behavior, we're also hoping to see whether, when people are going through these psychedelic retreats or psychedelic experiences, if they are also changing behavior. So we're trying to get more direct evidence. It's not there yet.
Yeah, I was going to ask, are there any studies that you knew of going on around the world that were starting to focus on that? But is that the answer? Is that there are studies that are going on for maybe other things, but they're adding more behavioral questions to the outcomes?
Yes, I guess the closest that we have right now are the addiction substance use trials, which are increasing for more substances, for more sort of specifics of these dysfunctions or these conditions. There's also interesting lines of evidence that are getting closer to the topic that we've been covering, which are the eating disorders trials that are popping up. So, as you know, there are a couple of studies that have looked at secondarily at sort of symptoms of anorexia. There are now at least 2 trials that are starting right now, looking at whether psychedelic experiences could help with eating disorders. And there's a very recent study that is now starting recruiting for binge eating disorder, which is very interesting because binge eating disorder is actually very concurrent with obesity in many cases. Unlike anorexia, which is a totally different population, binge eating disorder and obesity sometimes go together. So many people with obesity suffer from binge eating disorder and vice versa. So we're getting close to this sort of lifestyle behaviors. It's not just a psychological dysfunction or a mental health condition, but it's also a behavioral condition. And those are the closest studies that we have that I'm aware that are looking into this. But I'm waiting for the registered trial that shows up looking at obesity or weight loss, because I think that something's going to pop up soon around this area. That starts investigating more concretely whether people can be sort of prompted to change diet and exercise, and whether that might have an impact on their weight regulation. So yeah, that's where we are. And the observational studies, I think, are going to get more specific, and also asking more specific questions, whether in retreats or population data around health behaviors. And that's, I think, the call that the 2 colleagues that wrote the behavioral psychedelics, they wanted that to happen. They wanted for us to have more behavioral measures in these trials.
Yes. And as we wrap up, can you tell us a little bit about what your group is working on? And I know you have an opening. So, listeners, if you are interested in participating in this type of work, Pedro will tell you what, I mean, he is in Portugal, so that may narrow down the amount of people this could be applicable to. But also, before I let you go on to talk about your thing, anybody who's listening to this, and it's funny because I think you kind of nailed it on the head before. mental illnesses or mental conditions are something that we keep so much more, hidden stigma wise or whatever. And I think that there's a hesitancy to talk about it. So I've never on an episode been like, has a psychedelic helped your depression? Tell me in the comments of Facebook, right? Because it's such a private thing to share. But I think people, like you said, are much more open about being like, oh yeah, now I get 10,000 steps after I did my psychedelics, or I'm much more likely to take a walk in nature. So listeners, if you want to share, this is what I think is interesting is there are these studies, the Johns Hopkins one we talked about earlier, and this has happened in cannabis before, is that when people share their kind of incidental findings with a substance, then those can be researched. Like if people were taking CBD and it was like, oh, incidentally, all my seizures went away. Then they studied it for seizures, right? So everybody comment if you want, comment what health behaviors you have noticed change. And, maybe that'll give people fodder for more areas of study in this research. So anyway, side note, Pedro, take it away.
No, thank you for that note, because it's very interesting from a researcher's point of view. I think we want to know what's out there. We want to know what's spontaneously happening, so that we can have the basis for more sort of design studies, for more empirical work to be designed to look at those behaviors. So it would be very interesting if the conversation would increase around this topic, and we are very open to receiving. And I guess it's one of the advantages of being in your podcast is perhaps there's a researcher out there who also has an interest in health behavior change and psychedelics, and would like to collaborate. We're very open to in the spirit of collaboration that I think the psychedelic community is known for. We're also very interested in collaborating and joining up and having sort of open science type of collaborations. So, and that's really what we are doing. I think I've covered some of the collaborations that we have ongoing. We are complementing the ceremony study from Imperial and adding some behavioral measures to that. We're also replicating the study that I told you about around ayahuasca users, and comparing, in this case, with the Portuguese population. We want to do that. We have a very interesting study where we are actually asking psychedelic practitioners what do they think about this topic, because they are probably the ones that have seen these changes the most, perhaps in themselves, perhaps in clients who they've worked with, or patients they've worked with, whether it's, we don't care where people were working. But I think it's very interesting to ask the people that have guided others in the field to see what have they observed, because they see a lot of things happening. They hear a lot of stories, and we actually want to systematically, in a scientific way, ask a sample of practitioners whether they've seen these changes happening and what do they think the mechanisms are behind it. So that's one of the studies we are starting now. We also want to ask about healthcare providers, whether what are their attitudes generally about psychedelics, but also what do they think about behavior change. Indeed, I mean, I've worked before with primary care physicians, and they are very passionate about behavior change, about health behavior change, because they know how important it is for the conditions they see daily. We are very preliminarily exploring VR and digital games, whether it could also be a sort of a proxies for a psychedelic experience, and also be sort of promoting changes if the context is right. I mean, you can clearly think of a VR experiment where it's about your weight, or it's about your your body image, or it's about your eating, and you can play with that, and that could be another interesting avenue to pursue. But we'll put the link to my group's website on the show notes, I'm sure, and if people are curious, they can contact me. And indeed, we have a position open for a new postdoc. They don't have to be in Lisbon, so they can work remotely. We might convince them to come at some point, but it's not necessarily that they are here physically. What is necessary, however, is that they have obtained their PhD recently, within the last 3 years, and that's sometimes difficult to have as a selection criteria. But if you're out there, if you have a PhD in a related area within the last 3 years, and you're curious about the topics we've discussed in this podcast, we would love to hear from you. And you can just get in touch. My email will be, I'm sure, on the email notes, and I'll send you more information. And
Okay.
that's
Awesome.
that's it, Lynn Marie. Thank you so much for this opportunity, and I'm sure we'll speak about this topic again.
I look very much forward to our follow-up with all of the extra data that will come from the research you've been doing. Well, fantastic. Thank you so much, Pedro. And for everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review, as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.